Welcome to our first Hispanic-American Health Story Month. This is the very first program between the Larner College and CNHS, College of Nursing and Health Sciences. We are so excited to have you in this program, and we are so blessed to have our own Dr. Darin to be the first speaker. Yeah, so today we are just full of joy to just have you with us as much as this program is concerned. If you are here, it's because you want to know more, or you want to learn more about this particular program. You will see our QR codes. Let me go over some housekeeping items. So the very first one, our QR code for CMIE and evaluation will be displayed, and the links will be in the chat. Also, you have the link to the live captioning in the chat. And there are no financial relationships from speakers or reviewers here. We don't have any financial connection with this particular program. So that is our disclosure. And my name is Safako Kumabupumei. I'm the Director of Intercultural Excellence of the College of Nursing and Health Sciences. Today, our main presenter is Dr. Darin Woolpert in the program, who is the program director for the SLPA, that is the Speech Language Pathology Assistant, and the pre-master's SLP programs at the University of Vermont, and a licensed speech language pathologist. His research interests include narrative and literacy development in English and Spanish. He is also interested in international education, especially with regards to speech language pathology programs in Central and South America. So you are welcome once again. Thank you very much for being with us.
All right. Hello, everyone. Thank you for coming. I'm going to share my screen. My camera seems to have gone blurry for a moment. That's poor timing, but all right. So today I'm going to be talking about cultural and linguistic diversity in clinical practice. And I'm going to be taking sort of a bit of a big picture view rather than getting into the details of my own research. I'm happy to talk about that at the end if it's of interest. But I will start off as an overview of the talk. Going to introduce myself, talk about linguistic diversity in the United States, race and ethnicity, bilingualism, distinguishing between accent, dialect, and language, and then talk a little bit about perspective before wrapping up and having time for questions. I wanted to do the intro partly, some of you don't know me, and I do remember a while back I was doing a practice talk for my brother-in-law who's a doctor, and he said, "Wow, this is just like a real academic talk." And he didn't mean anything by it, but I do understand, speech language pathology is in the social science. It's a little softer and squishier than maybe some of you all are used to in terms of coming from a hard science background. And so years and years ago, I got certified to be a teacher of English to speakers of other languages in Barcelona and Madrid. I lived in Spain for a couple of years. I got my doctorate focusing on reading and writing in Spanish-speaking English learners. So these are kids in the US who are coming from Spanish-speaking homes, but attending generally English-speaking schools. I worked as a bilingual speech-language pathologist in Southern California schools. My research, as mentioned, is about narratives and literacy in Spanish-speaking children. I'm fluent in Spanish. I lived in Spain. I visited Mexico, Guatemala, Costa Rica, Panama, Peru, Argentina, and Chile. At the end of the month, I'm going down to Ecuador. I'll be presenting at a conference there with some colleagues at the University of Cuenca. At a previous institution, I was co-chair for the DEI committee, and I've also moderated a panel on cultural and linguistic diversity at a national conference. So this just, to give you some of my bona fides, as it were, and I, know a thing or two about what I'm talking about. So linguistic diversity, this is absolutely in my wheelhouse. This is where my expertise is. And we're talking about Hispanic history or Hispanic health story. And so I did want to start off talking about, even though there's some issues with Spanish speaking, language proficiency, and conflating that with being Hispanic, they certainly are very connected. In terms of the largest Spanish-speaking populations by country in the world right now, number one is Mexico. Number two is the United States. Number three is Colombia. Spain is now, it's been bumped down to number four. And I want to just emphasize this because I presented this to a colleague one time, and she said, well, that's so funny. It's almost like it sounded like you were saying that the US has the second most Spanish speakers in the world behind Mexico. And I said, no, that's exactly what I'm saying. And I will say Mexico has more than double the number, but still it's a very significant part of the linguistic context of the United States, but it is not the only part. Roughly 22% of people in the US speak a language other than English, according to the most recent census. There's more than 355 different home languages in the US. Some estimates put it over 400. So regardless of whether you speak Spanish or not, there's hundreds of other languages that you don't speak that someone somewhere in the US does. And so, for example, in Vermont, I believe it's English, then French, then Spanish, and maybe German after that. Some speakers of another language, a language other than English, will come from minoritized groups. Not all of them, but it's useful to talk about race and ethnicity, and specifically to distinguish these two terms from each other. This map, the key, I'm sure, is quite small on most of your screens, and I'm not going to spend too much time on it. You might be able to guess that dark blue is predominantly white. That's where Vermont is, Maine, what have you. Down closer to me, we have predominantly white along the coast, but then a lot of Hispanic population, and then there's other demographics represented. But there's a lot of different races and ethnicities in the United States. What do we mean by these terms? Well, typically, race is to do with genetics, with your ancestry, with who you are descended from, and maybe some of the physical, biological characteristics that you share. And ethnicity, typically, in sort of common usage, is defined as a cultural group that you are part of, someone that you share a culture with. It gets confusing because the census defines ethnicity as, are you Hispanic or not? And this was a bit of it was a means to an end in the 1970s. After years of lobbying, the people were successful in getting the US to include this category on the census. It was absolutely a political thing, and it was meant to help track outcomes because you had individuals who came from Spanish-speaking backgrounds and had a very different situation than the average white person, and yet they were all being counted within the same category. And so they argued that we should disaggregate and we should separate this out so that we can look at specific situations, specific issues that are facing individuals who are Hispanic, rather than folding it all in with the white people group. So there's definite utility in having, these boxes like this. And sometimes there's limited utility, and I think it's worthwhile if you have a clinic form that is tracking these sorts of things, is there some outcome that you're looking for? Is there something that some use for this data, or is it something instead where that's just what we do? We ask people to check the boxes because then we have the information if we need it. I will mention just briefly from my side, I have some, it's unclear what fraction, but I have some fraction Alaska Native heritage. And I sometimes am a little confused by which boxes to check here, especially because I don't really identify as Alaska Native. It's not a big part of my culture, but it is on the form, and they say select all that apply, right? So we have ethnicity being defined in the census by Hispanic or not. Race is more about kind of your DNA. But there's problems with this idea of race. And the biggest issue and this, I put race in quotes because I'm talking about the term itself and the meaning of race. There's a whole other discussion that could happen about racial dynamics and what have you. But the term itself is the definition is a construct. And I'll explain what I mean by that on the next slide. But we have this system of boxes, a system of categorizing individuals that doesn't really fit, and it doesn't always make sense. And in fact, if we talk about things in terms of genetics and ancestry, there's some groups of people with European ancestry who will have more in common with people who have Asian ancestry than individuals than other Europeans in some instances. And it can be challenging in terms of how do we pick which boxes. You could argue, I would argue, that the only two people who would be considered white according to the sort of definitions that we use on this slide are Antonio Banderas and Penelope Cruz. They are both Spanish, and so they are European, and thus they are white in terms of race. And then we have other individuals, I won't do everyone. Cameron Diaz, for example, is Cuban-American, Native American, Italian, and German. Derek Jeter, Black, English, German, and Irish. Zendaya over here is Black, German, and Irish. It's confusing, and it is ultimately, at least in the United States, it came about as a legal distinction. And specifically, it became highlighted in the 19th century. And you had legal status if you were white and different status if you were not. And there were individuals from Armenia who successfully argued in court that they were actually more white than they were Asian. And this term Caucasian is actually this is the Caucasus region, where you have Armenia, Georgia, Azerbaijan, and they wanted to have this additional legal status because why wouldn't you? And so they were trying to separate themselves from Eastern Asian individuals. So it's tricky because it's got this legal status issue folded into it, and people don't fit cleanly into boxes. And then in addition, we have problems with ethnicity, the term ethnicity. I touched on these a little bit already. It was a political distinction. And it's worth asking. We're doing Hispanic history, Hispanic health story month, right? What does Hispanic mean? What are the origins of the word? And if you speak Spanish, does that mean you are Hispanic? I mentioned Cameron Diaz before. She is partly Cuban American. So even though she has blonde hair, blue eyes, she is Hispanic by the definition that is used in common usage, people with ancestry from a Spanish-speaking country. She has ancestry from Cuba, but the origins of the term are belonging to or relating to Spain. So this brings up problematic history in terms of colonization, things like that. Um, and if you speak Spanish, does that mean you're Hispanic? No. I speak Spanish. I am not Hispanic. I know plenty of Hispanic people who do not speak Spanish. So those things sometimes go along with each other, but not always. And there's an issue with defining people in relation to Spanish-speaking ancestors. This weird thing of your ancestors' linguistic status defining who you are or giving you a category or a label, right? And in addition, there's research studies out there that conflate being Spanish-speaking with being Hispanic, which is not good, and it's not true. So, talking about speaking Spanish, it's helpful to talk about bilingualism. And this picture I actually took at the Burlington airport. It was very nice, multiple languages for to identify the men's bathroom. Um, this one I took at SeaWorld, and it's just I appreciate that they're trying to be more inclusive and things like that. The one thing that I find a little bit odd is just that they have separate buttons. It's sort of implying that the whale sounds you hear will be translated in Spanish, or that there will be some, it just makes noise and it plays the same noises whichever button you push. So I feel like it could have been one button with two labels. Anyway, that's a separate issue. But bilingualism is can be a tricky concept, and it leads to people asking strange questions. This purports to be a question that was sent to Department of Wildlife and Agriculture in, I want to say it might have been Montana. I would like to speak to your biologist in charge of any research on raccoons, which right out of the gate, I don't know that people have biologists in charge of raccoon research, but we'll put that aside. I believe mine may speak Spanish. I've spent longer than I probably should have trying to figure out what is meant by, I think my raccoon might speak Spanish. Maybe, yelling at it to go away in English doesn't work, and then you switch to Spanish and it does. I don't know. But people get strange about it, and it's understandable because there's problems with defining bilingualism, and people think about things in sort of strange ways. Here we have a subtitle that says cries in Spanish, which again, like we're talking about with the whale sounds, it's going to be the same, there's not a Spanish, a special Spanish way of crying. So I invite you to reflect on this in a course. I would do this more interactively, but I think for time purposes, I'll just invite you to reflect on: do you think of yourself as bilingual? And if you don't, and I imagine for many of you, you don't, because that's typically what happens when I present on this. Do you know any of another language? And that is almost always true, that you have at least some knowledge of another language. And so what is it that you don't have that would get you to qualify as, that would get you to sort of this bilingual status? Most everyone, depending on where they went to school, most everyone takes many years of foreign language in high school, and you are able to express, say some sentences, some phrases, engage in basic conversation, where is the library? And I'd like to buy the red umbrella. Very useful things like that. It is hard, though, to define what we really mean by bilingual, and different researchers have come up with different definitions over the years. Strict definition, like native-like control of two languages, which excludes many people who arguably are functionally bilingual, if not, strictly bilingual, or going way the other way, knowledge present to whatever degree in more than one language, which then means if you've ever ordered food at an Italian restaurant or happened to see an episode of Dora the Explorer, you are now bilingual. Congratulations. So that one is arguably brings too many people into the fold. Someone who can function in two languages according to given needs is okay, but it is subjective. And the bottom line is that bilingualism is not a categorical variable. It's not an either or thing. It exists on a continuum. There's very few people at the extreme ends, not to mention there's issues of, okay, spoken proficiency versus written proficiency. And there's plenty of individuals who are proficient in more than one language, but maybe only read and write in one, right? Are they bilingual, even though they're not biliterate? And these are open questions. It makes talking conclusively about bilinguals hard. You can't give a clear definition because it doesn't exist. So we have some idea, yeah, proficiency, being able to have a conversation. Sometimes people say, yeah, you have to be native-like, but you can be proficient without being native-like, and I would still argue that you're bilingual. So let's talk about bilingualism a little bit, especially some of you will be working with Spanish-speaking children from Spanish-speaking backgrounds. And we have some statements here, some common beliefs about bilingualism. For example, a child raised with more than one language in the home is likely to experience language confusion. You've got language coming in from, say, one parent and then a different language, and so the words maybe get all jumbled up. Bilinguals experience cognitive deficits due to their linguistic background. Children with language problems should not be exposed to more than one language because they're already, having challenges with one. So why would you complicate things by throwing another at them? And a child going silent when being exposed to a new language, which is a documented phenomenon, is a sign the child is being overwhelmed by the bilingual exposure, and you should cut back and you should switch to just one language. All of these are false. Language confusion, we'll come back to that, but there's reasons why people believe that it is a phenomenon, but it is not. If anything, there's research to suggest that there's cognitive benefits from bilingual exposure and developing bilingualism. And there's even, a lot of CDs and DVDs back, I'm aging myself, but they used to be marketed to parents to like teach your kids to speak French and then they'll be smarter. And there's actually no evidence that it is more difficult for a child with language problems to learn two languages. And if anything, they get a little bit of functional language in another language without seeming to impact their the amount of the first language that they know. And a silent period is a genuine thing, but it is not not a sign that they are being overwhelmed, confused, what have you. If there's one big thing that I hope that you take away from this, it's just this general idea that there's no reason to tell parents not to speak to their children in their home language. And in fact, there's good reasons for them to keep doing it, regardless of whether they have a language disorder or not. So with that in mind, I'm going to step you through a very brief clinical scenario. So we have a hypothetical child named, case made up, Jimena. Her family arrived in Burlington from Antigua, Guatemala a year ago. She started kindergarten, and that was the moment she had her first exposure to English. Her first grade teacher is concerned because Jimena is hard to understand, often makes grammatical errors in her speech. So Jimena would be what's dubbed an English language learner, even though arguably all children in US schools are learning the English language, whether they're monolingual or not. There's about 3 million of them in the US, approximately 10% of the total student population, and around 8% of the total population come from Spanish-speaking backgrounds. Now, before I talk about assessment, some of you are, from a medicine background, nursing, what have you, and I am going to confess that I am jealous of things like scales, thermometers, blood tests, because they're relatively objective and concrete. And I would love for there to be just a blood test for language disorder, or some sort of method of, an MRI that will show you how much vocabulary they have, something like that. Standardized tests have flaws. I'm not going to go into the whole thing, but you should at least be aware their origins are based in eugenics. IQ tests, the first standardized tests, were invented to try to come up with a way to scientifically argue that some races were better than others. And even if we put that rather troubling history aside, they are frequently biased. But that's what one of the main tools that speech language pathologists have. And so that's what we're going to be talking about. And for those not familiar, generally the mean score, the average score for a given age is 100. And then there's a standard deviation of plus or minus 15, giving an 85 to 115 range to be the typical range for that age. So speech language pathologist goes in, they know to do a comprehensive evaluation. So they observe the child in the classroom. They note that she has trouble following directions, completing assignments. She does not interact with peers. And the teacher goes on to add that she's concerned there's developmental delay or disability, possibly autism, which, you have social impairment, limited communication, things like that. Okay. And then if we look at some of these standardized test scores, remember, we're looking at a typical range between 85 and 115. We have a receptive vocabulary of 69, expressive vocabulary of 60, and then an overall omnibus language score of 67. And a score of 70 is 2 standard deviations below the mean, or around the second percentile. So there's Jimena scoring as well or better than 2 out of every 100 kids. And the prevalence of autism is about 3%. So if you're below the third percentile, then okay, there's a case to be made here. So then we ask the question, does Jimena have a delay or disability? And Jimena's parents were told by a kindly, well-intentioned pediatrician they should stop speaking to her in Spanish to avoid confusing her. Is this evidence-based? And I've already tipped my hand a little bit about that. But as far as this first question, does she have a delay or disability? You don't know. You haven't tested her in Spanish. And none of those test scores alone are clinically significant. In speech language pathology, we're using standardized tests to get at something in a very indirect manner. And I've tried to come up with like a good analogy for it. And maybe it's like trying to diagnose a broken arm by giving a person something very heavy to hold, and then it falls out of their arm. And you say, okay, well, maybe their arm is broken, but there's other reasons that could explain this. For example, maybe they lack the strength, the skill, the experience, the proficiency to do the tasks that you're asking them to do, much like a child who has just started having her first exposure to English will lack the exposure, skill, proficiency in order to be able to perform at age level based on monolingual norms on a standardized test. And is it evidence-based to say you should speak to the child only in English? No. Language confusion is not a genuine phenomenon, and the evidence says support for a home language, in this case Spanish, actually leads to better English outcomes. It's counterintuitive. It is something that just instinctively doesn't make a lot of sense, but it is true. And the reasoning is that if you get skill in one language, that gives you a scaffold, that gives you a foundation to then learn another language. Whereas if you're not skilled in one language and then you start learning another language, it's more challenging. So we've been talking about bilingualism. We've been talking about different languages. I wanted to talk a little bit about accent versus dialect versus language in terms of linguistic diversity. And so I'm going to start off, what's the difference between accent and dialect? Well, I'm a speech and language pathologist, and one of the first things I do with my students, day one of classes, I say, okay, you're a speech language pathology student. What's the difference between speech and language? And it's one of those very professory questions that they all, I mean, I know what it is, I just can't explain it, right? Speech is the physical act of producing sound with structures in the body. Language is a shared system of giving arbitrary meaning to symbols through rules. So you need to communicate a message to someone. You could speak it, you could text it, write it, what have you. The content of that message and the rules for making the message are the language part. There's a very big difference between the dog bit grandma and the dog was bitten by grandma, because we have rules about, active versus passive voice and who is the doer and who is the receiver of the action based on that. Likewise, accent is variation in how words are pronounced. So this is a speech variation. Dialect is distinct rule sets for variations of a language. So it maps very nicely. I color-coded it just to help reinforce this idea. But speech is tied to accent. Language is tied to dialect. So dialect is language variation. It's used by an identifiable group of people, includes different words, often different grammar. Throw me down the stairs, my keys. I had a friend from the Pennsylvania Dutch country, and the first time she said that, I said, that is the weirdest thing I feel like I've heard. This was in my younger days before I was better at being more accepting and inclusive of linguistic diversity. But it's a syntactic rule, and they flip the order of things. So also throw the cow over the fence some hay, for example, is another one, instead of throw hay over the cow to the fence. Or I have some middle schoolers in my home now, so it's giving cringe. He thinks he's a Sigma, but he has 0 Riz, right? That is a dialect. Those are terms that are being used by an identifiable group of people, specifically people much younger than me. And sometimes it makes sense to me, and sometimes it doesn't. So what about dialect versus language? This is often an arbitrary political distinction. Max Weinreich said a language is just a dialect with an army and a navy. So if you have a military behind you, then you get to call it a language, and otherwise it's just considered a dialect. And there is something to be said for that, because it is a political distinction. But generally, dialects of a language are mutually intelligible. That's broad and not always true. Mandarin is the official language of China, but most dialects of Chinese are not mutually intelligible, and so don't fit this definition. Mandarin and Cantonese are the 2 biggest dialects of Chinese, and yet they're not mutually intelligible. And then meanwhile, you have languages like Flemish and English that are mutually intelligible, but they're considered separate languages rather than dialects of a language. Spanish, like any other language, has dialects. And sometimes when I'm talking to students, they're surprised about it. And I say, well, there's people speaking Spanish in Europe. There's people speaking Spanish in the Americas. We speak Spanish very differently than, sorry, we speak English very differently than many people in England, right? And they might say, lorry when we say truck, what have you. I won't get into like a whole thing about it, but even the word car, right? It can be carro, it can be coche, it can be auto. So it makes sense, just like there's different dialects of English, there's different dialects of Spanish. So don't assume that just because someone is Hispanic or Latino that they speak Spanish. And if they do speak Spanish, don't assume that they speak the same dialect that maybe you learned in high school or what have you. English has a lot of dialects. I'm not going to dive into them too much. I will give a shout out to Eastern New England English. Can't get there from here. All that. But dialects are rule-based ways to communicate information, and linguistically, no dialect is better or worse than any of the others. But we do have what's commonly referred to as general American English, sometimes referred to as newscaster English. It's widely perceived among Americans as lacking any distinctly regional, ethnic, or socioeconomic characteristics. But this is not true. It is definitely influenced by where it is spoken, who speaks it, and there's absolutely socioeconomic factors and other things at work. But it is dominant for now in the US. And so there is this perception that it is neutral, that it is the default, and that everything else is different, and it's just the base dialect. The reality is it is one of many dialects of English. I want to talk briefly about perception and prestige dialects. If you'll bear with me, I do like to use humor in my talks, especially in the classroom. I think it can actually help memory and things like that. So I'm a fan of Saturday Night Live. We have this clip of two women playing characters from Long Island, and in this clip, they're interviewing somebody from England. They're talking to them, right?
Everything sounds better with a British accent.
Yeah, you know what? I wish we had accents.
Me too.
Love them. Love those accents.
So sexy.
You know what else? British people are dignified. They got manners.
All right. So they're speaking quickly there. I'm not sure how well the sound came through. They say in a very strong Long Island accent, "I wish I had an accent." Right. And that is the sort of what's going on with, the crowd laughs at that because they say, well, obviously you have a Long Island accent. But same thing with general American English. That is also an accent and a dialect, right? And then there's this issue of prestige. And you have them saying that English people are dignified, and there's all sorts of other associate, more intelligent, more classy, more refined, what have you. One of the main features of kind of received English or BBC English in England is R dropping. And my friends from Boston who are talking about park in the car and Bahaba, what have you, Harvard Yard, I know, but anyway, they might rightly say, well, what I'm doing the same thing, and yet I'm being treated as though I'm more like working class, sort of a Goodwill Hunting type of a thing, instead of being very sophisticated, right? And so there is a perception of certain accents as being better than others, even though it's not true. And even when some of the features are this, dropping an R after a vowel, some people say, oh, that's sexy and dignified when English people do it. And that's, crass and not dignified when somebody from Boston does it. But another main point that I want you all to consider is that there's no such thing as accent, no such thing as dialect, which is when I first came across this concept, I said, well, no, that's absurd. Or put another way, everyone has an accent or a dialect, regardless of your background, regardless of whether the way you speak matches the dominant way of speaking in your linguistic community. You travel to Scotland, New Zealand, even Louisiana, you have an accent relative to them, right? And so even if you're not aware of it, you do have an accent, you do speak a dialect, right? They were not aware because they come from Long Island, everyone speaks like them, but they have an accent dialect too. This idea of perception, this idea of prestige dialect, and of thinking, well, this is just the normal way of talking and other people talk different, brings me to the idea of linguicism, which is bias against an individual based on their accent and or their dialect. And I invite you to think about, and this is something that I would argue is unavoidable, even if you're consciously aware of it, as I try to be now. Think of how much your impression of a person is based on how they talk, what they say, how well they express themselves. We use this as a proxy for how somebody thinks, how smart they are, all of that. And so then that works against people who talk differently from the mainstream, whether it's dialect, accent, or both, because of this issue of linguicism, of treating people differently based on how they talk. And you can have someone who is, say, a neurosurgeon, maybe a very accomplished neurosurgeon in their home country, and they speak your language, making grammatical errors and with an accent. And so the brain naturally says, oh, this person must not be that smart, even though that's not true, right? And so there is this issue of perspective. I'm not going to go into this too much detail. I could spend hours just on this idea, right? And for some of you, this falls under what's sometimes referred to as soft skills. And I can understand being like, well, no, I just want to know, like, if a patient presents and they have, they're from a Hispanic background, what, diseases are they at greater risk for? How do I work with an interpreter, what have you? But there's evidence that says, like, for a doctor, the biggest predictor of whether or not they're sued for malpractice is how much their patient likes them. And so soft skills are important and actually matter a lot for clinical interactions and for getting honest answers from your patients, and also compliance with, you prescribe a medicine, some other treatment. If they don't like you, they are less likely to do it. So I'm shortish on time. I'm not going to spend too long on this, but I was shown these pictures in a diversity training, and the moderator kept saying, so what do you see here? And we kept saying, okay, it's a lizard, like a chameleon, and it's a bird, it's a macaw or a parrot. And we said it multiple times, and she kept repeating the question. And I won't do it for both of them, but these are individuals wearing body paint. And so this is a leg, the foot is right here, the knee is around here. This is a hand, arm, shoulder. The other arm is wrapping around the head to make the beak. And, sorry. And this is the head. This eye is on the forehead, and then the woman's eyes are closed, right? So it's a human. It looks like a bird, and sure, it's definitely a representation of a bird. It's also a human. Both those things, which seem like they couldn't both possibly be true, are true. Much like, depending on where you stand, a 9 or a 6 on the ground will look like a different number. And I do appreciate that they actually, this person should be saying it looks like a 9, this person should be saying it looks like a 6. Or this idea of, depending on, if you're blindfolded, depending on what part of the elephant you're touching, you're going to think it's a rope, you're going to think it's a snake, it's a tree, it's a spear, what have you. And there's this concept of a both and point of view. Conflicting experiences of the same thing can both be valid. It's not always about right versus wrong, good versus bad. And this is something I try to teach my kids. When one of them hits the other and the other cries, and the first one says, well, that didn't hurt. It's like, well, you don't know that. And maybe we can reserve judgment a little bit. So giving a little bit of perspective before we wrap up. If we shrunk down the world's population to 100 people, 12 would speak Chinese as a first language, 6 would speak Spanish, 5 would speak English, the majority would be bilingual. And yet the vast majority of language research and language tests focus on monolingual English speakers. And so there is, some bias there and reason to have additional perspective. So wrapping up in terms of terminology, race, ethnicity, bilingualism, language, dialect are all complex topics, not easily defined, but hopefully I've given you a sense of kind of the complexity that's there and a sense of how to differentiate between them. Hispanic is not the same thing as Spanish speaking. Measuring language objectively is extremely challenging just because you get a speech language pathologist's report that has standardized test scores in it. Don't say, okay, well, I'll just go based on the numbers, because sometimes it's more complicated than that. Poor single language test scores are not the same thing as having a disorder, even though that's typically what we assume. Much of our opinion of people is based on what it sounds like when they talk. It's easy to assume you are just normal when the way you talk matches the majority around you, just like you might say, oh, I don't have a culture, I have regular culture. But there isn't really a normal. You have distinct aspects of it, whether you're aware of it or not. Just going to briefly put in a plug for a course I have coming up in the spring called Cultural and Linguistic Influences on Development. And in the summer, a trip to Argentina, medical and educational support for children with developmental disabilities, and give some time for questions.
Thank you so much, Dr. Woolpert. A lot to sort of think about there. Some things I had not thought about, so I think that this is great. So we have opened up the Q&A for folks. If you have questions, you can certainly submit them via that the bottom of the screen, the Q&A link. Let's see.
While we're waiting, one thing that I didn't get to when it comes to linguistic perception, dialect, and accent was a perspective I came across that talks about in cartoons, especially like older Disney cartoons, the head villains all tend to speak with a British accent, so like Scar and the Lion King, for example. But then the henchmen all have American accents that are associated with racial minorities. And so there's this strange, linguist, racist, implicit bias in some of those older movies. Let's see. Do local interpreters have varying dialects? How would you uncover which dialect you need to request? So yeah, they're going to have different dialects, and I don't know. I feel like a lot of systems now use a phone-based system, something where you contact an interpreter remotely, and I don't know that you get much choice over that. Ideally, if you are doing something in advance and you have the time and the mental capacity for it, you would try to find somebody who matches not just the language, but the dialect, especially someone from the community who might understand some of the finer points in that regard. And yeah, so I think in practice, it would be difficult to operationalize that, but certainly it's something to be aware of if you have, for example, some Spanish proficiency, and you're going to communicate with the person, they might have different words for certain things.
I actually have a question.
Sure.
Can you give us some insight? How can clinicians better understand the cultural landscape of their local communities to inform their care?
Yeah, so I mean, the short and slightly unhelpful answer is part of your continuing education. I would argue you have an ethical obligation to seek out continuing education, working with the cultural groups if they're predominant in your community. But in addition, it can be very helpful to have, if sometimes it's the interpreter, right, or some other individual who can act as a bit of a cultural broker and sort of explain the back, there's different beliefs, different superstitions. I've heard a story of some Latino family, you give them like ice chips to do like a swallow a vowel or something like that, and they have maybe a superstition about really cold things making you less healthy, and so there's an issue there. So yeah, it's challenging, and at the end of the day, I think unfortunately the burden falls on the clinician to work on that and develop it.
Yeah, I'm sort of aligned with that, as well as sort of thinking about how to navigate cultural differences and family expectations around speech language pathology interventions. Any thoughts
Yeah,
on that?
absolutely. So I, when I teach grad students, especially in this area, I talk to them about working with an interpreter. Ideally, and again, I know this is this is kind of the unicorn idea, and not necessarily the practical in the real world, but meeting with the interpreter ahead of time, talking through what you're going to be talking about, and then having a debrief after. Was there anything you noticed? What have you? That's, of course, very important for a speech language pathologist, because if you're working with an interpreter, sometimes you are conducting a full language assessment through them. And so there's going to be all sorts of aspects. You have to tell the interpreter, please do not fix what they are saying. I need to, if they make a mistake, then tell me that they made a mistake, even though naturally you're going to be kind of adjusting as adapting and trying to fix errors as they come up to make it sound more natural and more grammatical. And I will, you mentioned family, which makes me think, this maybe happens more in public schools and less in clinical settings, but every now and then I hear about a kid being asked to be the interpreter for an interaction. And I feel, especially if it happens in a medical situation, it makes me very uncomfortable. It's a lot of pressure to put on the child. So ideally, at least have it be an adult, preferably somebody with training as an interpreter.
I see there are a couple of questions as
Yeah.
well. One is, are you familiar with iPads being used for language translation in clinical settings? And is this better or not for human translators?
Yeah, so I would say the one advantage I can think of is this idea of availability is the best ability. But they are going to be limited in terms of how much context they can give you. They're going to give you one translation. Sometimes the translation isn't going to account for dialectical differences. In Mexican Spanish, the word strawberry is slang for like a stuck-up person. And so you'd be looking at it, say, it says strawberry here, I don't understand. So there's issues with that. And a human translator, again, can be a bit of a cultural broker and kind of give you ideas of like, it occurs to me that in their community, this might be a factor, what have you. In terms of how the term Latinx should be used, it's my very strong sense is it's generally preferred to Hispanic, because Hispanic has this colonial tie to tying them to Spain as a country and the Spanish language. I could do a much deeper dive, but I will just mention there are others who have said, well, Latinx is very much an English term. There's no term in Spanish that would end in this way. And so some people say Latine is better. But yeah, in terms of inclusivity, the issue with Latino is it's masculine. And so there's gender bias, but then there's gender bias baked into the Spanish language and in the grammar itself. So it gets tricky. Let's see. Thoughts or experiences related to societal pressure toward monolingualism. Yeah, I'll try not to get myself in too much trouble here. Just reiterating what I said, the evidence says that there are advantages to being bilingual and there are no disadvantages to being bilingual. And so, for example, English-only education and prioritizing monolingualism is not scientifically based. And as we become a more and more multilingual society, it seems like it's almost all upside in terms of having more linguistic proficiency. And this maybe is somewhat biased based on my background and my expertise, but I talk to adults all the time who say, I wish I could speak another language. Like, is there a secret to, like, I've been doing Duolingo for 5 years. People want to, it's a useful skill. It's very beneficial. And the easiest time to pick up another language is when you are a kid. And babies can be, if they're exposed to language bilingually, will become bilingual speakers with very little extra effort. They don't have to have after school tutoring or special classes or anything like that. So yeah, I would say that that's a very beneficial thing, and there's not a reason I know of not to encourage bilingualism. What if a provider speaks the same language other than English that the patient speaks? Is it better or more accurate for that provider's? Yeah, that's a great question. And I would say, yeah, if you are proficient in the language, it couldn't hurt to have the interpreter be there just to double check things. But you're going to be much better able to say, oh, okay, I notice when they're responding to this question, this is kind of how they reacted, or they seemed a little bit cagey or something along those lines. Not to mention, even regardless of whether you are having the interaction directly or working with an interpreter, the ideal is to be looking at the patient, looking at the client, even though you're going to, instead of directing what you're saying to the interpreter. How do you approach circumstances where interpreters being used are often the same? Yeah, that's a tricky one. And ideally, if they are working professionally as an interpreter, then they've had some HIPAA training and things. I don't know if everyone can see the question, but the question is, what if they're from the same community and it's a small community and now they're getting private health information about, potentially their neighbor, their friend, what have you. That's an issue. If you work in a small community and you are a nurse, a doctor, a tech, you're going to find out some things about your neighbors. That way, I think it sort of goes along with working in a small community sometimes. And certainly you want to be aware, like, this is not something that you can share outside of this room and things like that. But again, hopefully they have training as an interpreter, they're familiar with HIPAA and all of that stuff.
Well, thank you all for staying with us till now. And thank you so much, Dr. Darin Woolpert, for educating us with this topic. This is, as I said, this is the first ELCOM and CNHS event. So please wait for more and watch out for more interesting discussion along the way. Thank you, Dr. Woolpert.
Yeah, thank you for the opportunity. It's a lot of fun.